Hi, so my name is Kristina. I'm going to be here doing the head to toe assessment on my patient. I'm going to start right now. So I give her privacy. I start also with hand washing and then I introduce myself. So my name is Kristina. I'm going to be your nurse this afternoon. Can you tell me your name, please?
My name is Emily Hernandez,
And your date of birth?
January 19, 1999.
Awesome, awesome. So I need you to remember just a couple of things. I'm going to give you one little sentence for you to remember. So at the end, you can let me know if you remember it. Okay. So the sentence that I'm going to give you is going to be, I love pillows.
I love pillows.
Okay, perfect. So I'm going to go ahead and I'm going to start right now with inspecting your head. What I'm doing is inspecting your head for any type of lice or any type of lesions or anything that you would have. Right now, I don't see anything whatsoever. I'm going to check your scalp to make sure that you have normal cephalic configuration. Perfect. I'm going to go ahead and I'm going to check your ears. I'm going to take the pain out. Do you have any pain? Does this feel okay for you?
Yes.
Okay, I'm going to inspect them to make sure there's no oozing or anything coming out of the ears. Perfect. No oozing, nothing coming out of the ears. So I'm just going to go ahead and take a look at your eyes and make sure that the sclera is white and your. So I'm just going to pull down your eyes and make sure the insides are nice and pink. That's perfect. I'm going to take a look upside your nose to make sure that there's no mucus and it looks nice and pink. Can you open up your mouth, please, so that I can look in your mouth? Perfect. Everything looks perfect. Fantastic. So now I'm going to go ahead and I'm going to test your cranial nerves. So I'm going to start with cranial nerve number 1. Step this way 1 second. Close your eyes and let me know what you smell.
Coffee grounds.
Perfect. So we know that cranial nerve number 1, which is the olfactory, is intact. You can go ahead and open your eyes. Now I'm going to test cranial nerve number 2, number 3, number 4, and number 6. So that would be if you could please just close one eye, like this, and go ahead and read the lowest line that you can.
Okay. A S S E S M E N T.
Perfect. And if you can do the same thing on the other eye.
Same line?
Yes. Or the lowest that you can see.
A S S E S M E N T.
Perfect. So now can you do me a favor and can you go ahead and keep your eye focused on the top right hand corner of that, and I'm going to check your pupil for pupil dilations. Perfect. We have dilation and restriction. I'm going to do the same if you'd like to take a look over here. Perfect. That's perfect. So can you do me a favor and can you follow the pen for me without moving your head? Perfect. So now I'm going to take the pen and I need you to follow the pen all the way in. Perfect. Thank you so much. And then now we're going to test cranial nerve number 5. Cranial nerve number 5 is, can you let me know if you feel something soft or something like a pointy?
Kind of pointy. Soft. Soft. Pointy. Soft. Soft.
Perfect, perfect. So I'm going to test cranial nerve number 7 now, which is your facial. Can you go ahead and move your eyes up, your forehead? Perfect. Can you frown for me? Can you smile for me? Can you puff your cheeks out? Perfect. I'm going to go ahead and I'm going to, can you bite down for me, please? Perfect. So now I'm going to ask you to stick your tongue out, please. And say ah. Checking to make sure the ula is moving up. Perfect. That's perfect. Okay. And the only other thing I need you to do is to shrug up. Perfect. And bite one more time. Fantastic. So now I'm going to check your neckline. I'm going to palpate the carotid artery. I'm actually going to listen to it to make sure there's no bruise. Perfect. And can you turn your head for me, please, like this? And this way as well? Perfect. I'm going to check your trachea for midline. Can you swallow for me, please? Perfect. Perfect. Okay, I'm going to ask you to put your head to a 30-degree angle so I can check for JVD to look for any pulsations. And the other side, please. Perfect. I don't see any type of pulsations that are going to be there. So now I'm going to check your lymph nodes. So I'm going to pull your hair back here. I'm going to check for your post and pre-auricular, your occipital, your superior and inferior clavicle, and your submandibular. And for your auxiliary, can you lift your arm just 1 second? Perfect. So now we're going to check your respiration. So I'm looking at your respiration. As of now, it looks like it's pretty full. Perfect. And I'm going to check your lungs. We have no barrel chest here, no bird chest. Everything looks great. I'm going to take a listen to her lungs. Can you breathe in and out for me? Will we turn around and do the same thing? I don't hear any crackling, any wheezing. Perfect. While we're here, go ahead and stay right there. We're going to go ahead and check for the range of motion. We'll go ahead and breathe it. Now go ahead and breathe in for me real deep. Perfect. Bilateral. Perfect. And can you go ahead and bend forward for me, please? I'm going to check for any type of scoliosis. Spine looks like it's intact. And we're going to go ahead and check your kidneys. So right here, can you please tell me if you feel any pain here or any type of pain? So now I'm going to check your kidneys. Do you have any pain here at all?
Nope.
No? Okay, so I'm going to go ahead and press. Do you have any pain at all here?
Nope.
Okay, let's check the other one. Any pain, any tenderness here on this side?
Nope.
No? Any pain?
No.
Okay, perfect, perfect. So you can go ahead, you can turn around. I'm going to go ahead and check your chest. So we're going to start with the listening of your aorta. Check your aorta. Going to go over to check your pulmonic. Go down to herb. I'm going to go down to the tricuspid. Perfect. Sounds nice and normal. And then I'm going to go to the mitral. Perfect. I'm also going to look for a pulsation point. And I can feel it. It feels normal. Perfect. Perfect. Heart sounds great. So we're going to go ahead and we're going to inspect your abdomen. So right now her abdomen, it does look like it is not full, and it is perfect. So it doesn't look bloated. I'm going to go ahead and I inspected it. I don't see any hernias or anything, any umbilical hernias or anything going on here. So I'm going to go ahead and I'm going to listen to. Starting off with the right lower quadrant. Listening for any bowel signs. Up to 5 minutes, I should hear something. And I do hear bowel movement. Can you tell me when you had your last bowel movement?
This morning.
Perfect.
Probably around 9:30.
She should be laying down, but we don't have that accommodation here. I'm going to go ahead. Everything sounds great. I'm going to go ahead and put a little pressure. Can you let me know if you feel any pain here?
Nope.
Any pain here?
Nope.
Any pain here?
No.
Or here?
No.
Perfect. Any pain?
No.
Pain? Normal sound for her. Perfect. No hernias, no tenderness, nothing in here. So now we're going to go ahead and we're going to test your Rombauer testing. So that is going to actually test your, to make sure that you're not swaying and your equilibrium is okay. So can you close your eyes for me, please, and put your hands to your side? I'm just going to take a look to make sure that you don't sway at all. Perfect. Slight movement is also normal. So we're going to go ahead now. We're going to inspect your skin. Make sure your skin looks good. Everything looks perfect. Hairlines look great. We're going to check for edema and for capillary refill, which is kind of hard, but to see because she's got nail polish, we definitely can see that there's no edema. The capillary refill is sufficient. Perfect. Perfect. Go swing around. Check out your skin on the back. Perfect. Perfect. So then we're going to go ahead and test strength testing. So can you go ahead and squeeze my hands both at the same time? So her strength is the same bilaterally. Perfect. And can you go ahead and push down on my arms? Perfect. Perfect. We're going to go ahead and do the same thing for your legs. So can you lift your leg up and push down, push up on my... Perfect. Perfect. We would check her reflexes here at this time if we did have a reflex fork. Yes, so we're going to go ahead and check her legs as well to make sure there's no edema, no clubbing of the feet, no clubbing of her nails. Everything looks perfect. So I am going to tell you where all of the pulse points are. So here you have your carotid artery pulse points that are going to be here. You do have your temporal that is going to be here. You've got a radial, which is here. You have your brachial, which is here. On the legs behind her knee, the popliteal is going to be here. You have your pedal and your anterior tibula. You have all of those pulse points. We also are going to test her memory. Do you remember what I asked you to remember?
I love pillows.
Perfect. So she does remember, so she is cognitive. No clubbing of the feet, no clubbing of the hands. Capillary refill is perfect. The only thing that I did miss in the beginning, so I'm going to do it right now. If I did have a pitchfork, so with a pitchfork, let's just say that this is my pitchfork, I would have hit the pitchfork with it and put it on top of her head to test Weber, and she should feel vibrations going down her head here. And then the same thing, I would hit the pitchfork again, put it on the mastoid, and then afterwards she should hear vibrations, and then she should hear it ringing. So that completes my head-to-toe assessment with Emily. Thank you.